Hello everyone, I am Sandra May Brunyolo from BSN 111A. And today we are going to learn about the bed making procedure. Bed making is one of the most important nursing techniques to prepare various types of bed to the patient or clients to ensure comfort and useful position in a particular condition. So the purpose of bed making is to provide a comfortable and safe bed, to prevent bed sores, to promote cleanliness, and of course, to give a proper medical and nursing care to the patient. But first, we are going to collect all the materials that will be used through arranging them in a reverse order. We'll start with the pillow with cover. Next, the blanket. Then the top sheet. Then the throw sheet. Then the alternative waterproof underpads. And lastly, the bottom sheet. And place them in the table to prevent getting any dirty. So there are few things or few points that we are going to remember upon performing the procedure, such as hand washing to prevent the spread of pathogenic microorganisms. Now, it is important to remember that when placing the equipments, it should be stocked according to what we should use first so that it is much more easier to perform the open and closed unoccupied bed. For body mechanics and safety, this procedure will take a long time, so we'll need to keep our feet apart to reduce the gravitational force, allowing us to avoid becoming exhausted while performing the procedure. Because all over the microorganisms will be present in the washable cover of the mattress, the first thing to do in bed making is to make sure that the mattress has already been cleaned. We can clean it with the antiseptic solution and a damp duster. But if you don't have a washable cover of the mattress, just like what we had here, we will just expose it to the sun so it can kill the microorganisms. So now, we'll be putting the bottom sheet on the bed. We'll carry the lining like this and remembering to keep distance. We'll not carry the lining like this where it will just give us strain. So we'll put the bottom sheet on the center of the bed or in the headed side of the bed. We'll just unfold it. And if you notice that there are 3 layers, we've done it correctly. Afterwards, we're going to unfold the sheet towards us. And roll down the second layer of the sheet. And then unfold the sheet onto the mattress center. While unfolding, make sure or to ensure that there will be no crease or wrinkles as much as possible. For our goal is to make or provide our patient with a wrinkle-free bed. Now we'll miter the bottom sheet edges, which is used to secure the corners firmly and neatly. When tucking the lining, make sure that your knuckles is facing upward to avoid any injuries. So we'll just create a diagonal triangle first. Then we'll lift up the bed. Then we'll tuck in the excess linen. The next step is the alternative waterproof underpants. We will fan fold the waterproof underpants below the bottom sheet and place them in the middle of the bed or specifically under the lower part of the bed. Next is the draw sheet. We will fan fold the other half of the draw sheet and place it over the waterproof underpads in the same way we did with the waterproof underpads. Next step is the top sheet. We will fan fold or we will proceed to putting the top sheet on the bed after we properly place the draw sheet. The purpose of this top sheet is to place it underneath the blanket so that it does not irritate the patient. Place it at least 18 cm below the bottom sheet. Fan fold. Then we'll peel off the first layer. And then we'll roll the second layer towards us. Then roll it towards the center of the mattress. Next step is putting on the blanket above the top sheet. We will now take the blanket and drop it over to the top sheet, placing it in the center. Place the other side of the blanket under the top sheet, fan folded. Make sure that the top sheet and blanket are tucked in at the bottom of the bed and the linens are wrinkle-free. Now we're going to fan fold or peel off the first layer of the blanket and roll the second layer of the blanket towards us. And again, roll it towards the center of the mattress. Now we are going to miter the top sheet and the blanket together. Just create a diagonal angle or triangle. push the dough sheet together with the waterproof underpants all the way throughout the under of the bed. We will leave this side hanging and we'll move towards the opposite side of the bed. Now that we have moved to the other side of the bed, we will going to pull the bottom sheet first. Make sure that there's no crease. Then we will repeat the process of the tucking the edges with the miter process. We will create a diagonal triangle. Then tuck in the excess linen. Wrinkle unfolded free linen maximizes the patient comfort and decreases the skin irritation. So now we'll pull the waterproof underpads and the dough sheet together and tuck them under the mattress together with the bottom sheet. Again, make sure that there's no crease. After that, we'll pull the top sheet and blanket. We'll tuck the excess linen and miter the edges of the top sheet and blanket at the bottom edge of the mattress once more. Again, ensure that there's no crease. To create an open unoccupied bed, fold the top sheet and blank towards the bottom of the edge of the mattress. And then tuck in the excess. Now we'll proceed to the pillow cover. Lastly, we're going to put the cover of the pillow. But first, we'll scrunch the top of the part of the pillow until it reaches the end. Then reach the under of the pillowcase with the dominant hand and slightly roll it over and grab the edge of the pillow with your hand and put the pillow and grab the pillowcase until it completely covers the pillow. Make sure not to shake the pillow into the pillowcase to prevent the spreading of microorganisms. Also, it's important to remember that the pillow's end should face away from the entrance door. So, since our entrance doors is here, we'll place the pillow here. And this is the open and occupied bed. So, in the same way, we can make a closed and occupied bed, but the only difference is that we will cover the pillow entirely together with the top sheet and blanket. So, and tuck in again the excess. Make sure that there's no crease and all the linens are tucked in securely and firmly. In order to turn the bed into an unoccupied closed bed, we entirely close the pillow, and making sure that after this procedure, we'll perform another hand hygiene, which is the hand washing procedure.